Dr. Jonathan Cunha, visionary leader in cardiothoracic surgery and lung transplantation. In the world of modern medicine, few names stand out as prominently as Dr. Jonathan Cunha. Known for his pioneering work in cardiothoracic surgery and lung transplantation, Dr. Cunha's illustrious career is a testament to his dedication, innovation, and leadership. Currently, the Chair of Cardiothoracic Surgery at Mayo Clinic Arizona and a professor of surgery at the Mayo Clinic College of Medicine, Cunha has made significant strides in both scientific research and clinical practice. This article delves into the career of Dr. Cunha, his contributions to medicine, and his impact. Early life and education. From a young age, Jonathan Cunha exhibited a keen interest in healthcare. Growing up, he often expressed his dreams of entering the medical field, a passion that would eventually lead him to achieve groundbreaking success. His educational journey began at the Medical College of Wisconsin, where he obtained both his MD and PhD degrees in microbiology and immunology. During this time, Cunha worked closely with leaders in immunology, focusing on the field of immunotherapy. His PhD thesis, which involved the discovery of a novel interferon-induced immunomodulatory cytokine known as ISG-15, showcased his early promise as a surgeon-scientist. Dr. Jonathan Cunha's work on ISG-15 established it as a cytokine with ubiquitin homology that could activate the innate immune system to combat viral infections and potentially treat malignancies by boosting the immune system. This research laid the foundation for his future endeavors in immunotherapy and oncology. After completing his medical education, Cunha furthered his training at the National Institutes of Health, NIH, as a postdoctoral fellow and research associate, where he continued to build on his groundbreaking work, advanced training, and early career. Following his postdoctoral training, Cunha attended the University of Minnesota, where he trained in general surgery before completing his cardiothoracic surgical fellowship. His time at the University of Minnesota was marked by significant achievements and contributions to surgical education. As a faculty member, he specialized in lung transplantation and played a pivotal role in surgical education as the Associate Program Director for both the General Surgery and Cardiothoracic Fellowship training programs. One of his notable accomplishments during this period was the development of a novel course for medical students transitioning to residency. This course, in concept and part, was branded by the American College of Surgeons, demonstrated Cunha's commitment to improving medical education. His dedication to teaching earned him numerous accolades, including the University of Minnesota Outstanding Medical School Educator Award and the Association for Surgical Education's Surgical Educator of the Year Award in 2011. Throughout his career, Cunha has mentored hundreds of undergraduates, medical students, residents, fellows, and faculty, leaving an indelible mark on the next generation of healthcare professionals. Leadership and innovation. Cunha's expertise and leadership did not go unnoticed, and he was subsequently recruited by the University of Pittsburgh. There, he held several key positions, including Surgical Director of Lung Transplantation, Chief of the Division of Lung Transplantation and Lung Failure, Surgical Director of Extracorporeal Membrane Oxygenation, ECMO, Vice Chair of Research for the Department of Cardiothoracic Surgery, and Associate Program Director for the Thoracic Residency Program, and Advanced Fellowship in Minimally Invasive Thoracic Surgery. One of Cunha's significant contributions during his tenure at the University of Pittsburgh was his work in ex vivo lung perfusion, EVLP. Recognized as one of the first to use EVLP in clinical practice in the United States, Cunha's expertise in this area has been instrumental in advancing the field of lung transplantation. His innovative approaches have improved the viability of donor lungs, increasing the success rates of lung transplants, and offering hope to countless patients with end-stage lung disease. Current role and achievements at Mayo Clinic Arizona. Today, Cunha leads the Cardiothoracic Surgery Department at Mayo Clinic Arizona as its inaugural chair. In addition to his clinical interests, which include expertise in minimally invasive and robotic thoracic surgery, lung, mediastinal, and esophageal oncology, Cunha specializes in the care of the most complex lung failure patients. As the Surgical Director of ECMO and Lung Transplantation, he continues to push the boundaries of medical science and clinical care. Under Cunha's leadership, Mayo Clinic Arizona has seen significant advancements in cardiothoracic surgery, and soon lung transplantation and EVLP. His vision for the future of lung transplantation is now being realized, with the clinic poised to perform its first transplant using these cutting-edge techniques. Cunha's research interests are broad, encompassing all aspects of thoracic oncology and lung transplantation. He has authored and published several hundred manuscripts, abstracts, and book chapters, and is internationally recognized for his expertise. Personal reflections and legacy. Despite his numerous professional achievements, Cunha remains deeply grounded and dedicated to his family. He proudly speaks of his children, 3 college graduates, who are following in his footsteps in the medical field. His eldest daughter is currently in residency as a doctor, while his middle daughter is attending medical school. His son, known for his wonderful personality, outlook on life, and career goals, adds to the pride Cunha feels for his family. Professionally, Cunha reflects on his career with a sense of accomplishment and pride. As a recovering perfectionist, he has shifted his focus towards well-being and leadership, transforming the practice at Mayo Clinic Arizona in ways that are being described as legacy building. One of the most meaningful accolades he received came from the late and iconic Dr. Thomas Starzl, who noted that very few 47-year-old surgeons have forged a bigger trail. This recognition, along with his numerous firsts in the field, stands as a testament to Cunha's impact on cardiothoracic surgery. Giving back and inspiring future generations beyond his clinical and research endeavors, Dr. Jonathan Cunha is committed to giving back to the community and inspiring the next generation of healthcare professionals. He has established scholarship funds for high school students at his alma mater, Cedarburg High School in Cedarburg, Wisconsin, and for graduating students pursuing healthcare-related careers. These scholarships, known as the Healthcare Heroes Scholarships, honor the class of 2020, who faced unique challenges due to the pandemic. Through these efforts, Cunha aims to support the educational expenses of future healthcare leaders, recognizing the critical need for bright minds in the field. Cunha's passion for mentorship extends to his daily interactions with medical students, residents, and young faculty members. He frequently shares stories of his experiences and the lessons he has learned throughout his career, emphasizing the importance of servant leadership. By focusing on the well-being and development of those around him, Cunha believes he can make a lasting impact on the healthcare system and, ultimately, on patient care. One particularly inspiring initiative led by Cunha was the creation of a month-long course for medical students at the University of Minnesota. This course, designed to prepare students for the transition to residency, provided invaluable hands-on experience and knowledge. The enthusiasm and thirst for knowledge displayed by the students were unparalleled, and many of them have gone on to become leaders in healthcare. To this day, Cunha occasionally receives notes from former students thanking him for the influence he had on their careers. A visionary's ongoing legacy. As Cunha continues to lead and innovate in the field of cardiothoracic surgery, his influence extends far beyond the walls of Mayo Clinic Arizona. His contributions to medical education, research, and clinical practice have set new standards and opened doors for future advancements. Cunha's unwavering commitment to improving patient care through cutting-edge techniques and compassionate leadership remains a driving force in his career. Looking ahead, Cunha's vision for the future of lung transplantation and thoracic oncology promises to bring new hope and possibilities to patients worldwide. His dedication to mentorship and community service ensures that the next generation of healthcare professionals will be well equipped to carry on his legacy of excellence. In the world of cardiothoracic surgery, Dr. Jonathan Cunha stands as a beacon of innovation, dedication, and compassion. His remarkable journey from a young aspiring surgeon to a world-renowned expert is a testament to the power of passion and perseverance. As he continues to forge new paths and inspire others, Cunha's legacy will undoubtedly leave an indelible mark on the field of medicine for generations to come.